Australia's life expectancy has fallen for the first time since the middle of the 1990s. The decline isn't much, and a male and female born in 2020 to 2022 can still expect to live on average just over 81 years and 85 years respectively. But Australia's population is ageing, with more people living with a chronic disease and spending more time in ill health. Here's health economist Dr. Martin Henscher. Hi Martin, so how significant are these reduced life expectancy numbers? They're not down by much, but it hasn't happened for 40 years, has it?
Good afternoon, that's right. They're not big decreases, and they are much smaller decreases than we've seen in the rest of the world. But it's an important reminder that life expectancy can be impacted by other factors and sometimes can be forced down, or clearly in this case largely due to the pandemic.
So COVID has played a large part in this?
Absolutely. COVID is very clearly the driver of this in Australia and elsewhere, both clearly direct COVID deaths, but also some of the sort of indirect impacts that COVID had. But yeah, COVID really has driven this very clearly.
Okay. Also, though, due to our ageing population, in what way?
So the fall in life expectancy is not itself because of the ageing population. In fact, obviously, if ageing means living longer, then obviously ageing and increasing life expectancy go together. It is true we have more older people, but it's not. In fact, this life expectancy fall is very directly because of the COVID impacts, but absolutely most COVID deaths were among older people. That is true.
Right. So what's the leading cause of death at the moment?
So in Australia still, the leading cause of death is cardiovascular disease. So that's really heart disease and strokes together. So that has been decreasing, but it's still out very clearly in number one as the main cause of death.
And what do these figures say about the healthcare system and its funding, Martin?
Well, I think, so moving away from the life expectancy question, the very important figures they gave us about chronic conditions in this report do unambiguously mean more people with more chronic conditions will lead to more demand on the healthcare system. And that really is going to lead to a need for more resources continuing over time. The key, though, is we really have to get the right resources to give people the right care, firstly to prevent these chronic diseases in the first place, but then to really manage them well. And that means really investing particularly in primary care to give people the personalised, coordinated care that they need. And really just regarding investment in the healthcare system is an investment in people's health, and being clear about the need to do that.
Martin, do you think, have we peaked? Has life expectancy peaked? Because it can't keep rising forever, can it, or can it?
That's a fantastic question. So kind of biologically, we know that some individuals can live well past 100. So there is a school of thought which said, you know, with ideal conditions, why couldn't life expectancy keep on going up, you know, to some point, that there probably is some natural limit, but we're not there yet. However, I think what's more important is that we know in some other countries, particularly the US, life expectancy actually fell for several years in a row before COVID, and that was really due to factors like economic inequality, drug overdoses and things, and life expectancy in the UK had been stagnating because of austerity and cuts in the health service and social care. So the real thing to focus on is that the choices we make have impacts on future life expectancy, and if we want to keep life expectancy increasing, we need to keep investing in keeping people healthier.
Dr. Martin Henscher, thank you.
Pleasure.